Hi colleagues, we are Group 1 and today we will be doing a project analysis of Anguilla's COVID-19 vaccination rollout. The presenters are Joseph Bob, Judith Miller Cruikshank, Nikisha Hodges, Nicola Smith, Shanette Rayside, and Stacy-Ann Dyer McNish. At the end of the presentation, the following objectives would have been met: an overview of the project, the core concepts introduced, the application of tools and techniques, an analysis of data, and to wrap it all up, the recommendations for the project. I now turn over to our first presenter, Nikisha Hodges, who will be giving you an overview of the Anguilla's COVID-19 vaccination rollout.
The year 2020 was the year that changed the world as we knew it forever. The emergence of the COVID-19 outbreak, which started in Wuhan, China in December 2019, in 3 months' time spread across the entire globe. By January 30th, 2020, the World Health Organization declared a public health emergency of international concern, and on March 11, it was declared a pandemic. The virus resulted in a large loss to human life, as well as social and economic disruptions as the world went into a great lockdown. All across the globe, countries were closing their borders, implementing quarantine measures, and practicing social distancing to contain the virus while waiting for vaccines to be developed. By the end of 2021, several vaccines were ready to be deployed, but on a limited basis. Anguilla, a small British overseas territory island in the Caribbean with a small population of 15,000 people, was fortunate thus far to have a few cases of coronavirus. However, the economy was severely impacted because of its reliance on tourism as a main industry. The Anguilla COVID-19 vaccine rollout program commenced in February 2021. The main objective of this project was to vaccinate 70% of the population by December 2021. This will help to reduce the threat of morbidity and mortality associated with the coronavirus. Such will also help the country to achieve herd immunity so that the borders can be safely reopened without restrictions to revive the economy. As an overseas territory of the UK, Anguilla was incorporated into the COVID-19 vaccine procurement as part of the UK's COVID-19 vaccine rollout program. Because the vaccine is being funded by the UK, Anguilla is only expected to incur costs for transportation and storage of the vaccine, promotion campaigns, and human resources. The main deliverables of this project entails promotion campaigns to dispel fears and build trust to encourage the population to take the vaccine, training for personnel on administering the vaccine, creating storage, coordinating and managing vaccine sites, and regularly updating information and dashboards. The AstraZeneca vaccine was chosen to be administered based on its suitability because it does not require extreme cold storage during transportation and storage. The vaccine will be administered based on priority groups. The groups are as follows in descending order: health workers, civil protection, border protection and port staff, hospitality workers, persons with underlying conditions, persons 65 years and older, and residents over 18. The key performance indicators as per the World Health Guidelines: would be vaccination coverage and vaccination uptake. This now concludes the overview. I now turn you over to Stacy, who will be presenting on the core concepts.
The following concepts will be highlighted and discussed: project monitoring and control, managing change, project analysis, control schedule and cost, control quality and risk, control communications and stakeholder engagement, control procurement, and closing project. Hi everyone, my name is Stacy-Ann, and it is my responsibility to discuss with you today some of the core concepts introduced in the course. The first one is project monitoring and controlling. And for the Anguilla's COVID-19 vaccination, monitoring and controlling is essential during the project's life cycle, as it will aid all parties involved in identifying and mitigating risk, track key performance indicators, review and manage documentation, give all parties involved a knowledge of the project status, and allow them to control scope creep. During the vaccination rollout, there are going to be some changes. However, these changes, according to Grey Campus, must follow a formalized change request process. There must be either approval or denial. And whatever the final decision is about this change request must be communicated and shared with all relevant key stakeholders. Another concept is project analysis. And for the Anguilla COVID-19 vaccination rollout, it was evident that one was conducted during the planning phase. This is important during the project life cycle as it enables leaders to determine the feasibility of the project, assist them in budgeting. It helps them improve their planning and scheduling. It helps in detecting and mitigating risks as they arise and even before they arise. And it also allows the team to expedite the monitoring and evaluation of the project. The next concepts are control, schedule, and cost. And for a project of this nature, it is very important, especially where scheduling is concerned with the pandemic that we face. When there is control of schedule and cost, project leaders are able to recognize deviation and variances in the plan. They are also able to put into place corrective and preventative measures. They're able to minimize any risk that can cause a delay in the schedule of rolling out the vaccination program and meeting the relevant deadlines. And also, it allows for management of approved cost baseline and the changes to those baseline. I now turn the presentation over to Nicolo, who will further discuss the other core concepts introduced in the course.
Thank you, Stacy-Ann. My name is Nicola. Let's take a look at control quality and risk and control communication and stakeholder engagement. The aim of quality control is to make sure that product quality maintains a certain standard and improve. Poor quality control can cause problems such as cost overrun and delays. This is why vetting, verification, and ratification is very important. As for risk monitoring and controlling, it involves keeping a track of identified risks and new and emerging ones, and having a response plan as well. Also, control, communication, and stakeholder engagement are very important for successful completing a project because poor communication can lead to misunderstanding. Controlling stakeholder engagement is vital because it helps project managers to identify issues, manage expectation, finding ways to improve relationships.